Terrific, Karthik. Thank you so much. When I first got to know Karthik, I pointed at him. I said, "You're health relevant." And he's proving that. Um, okay, great. So we're open for discussion. I think what we just heard are really two really important components. If you try to encapsulate Daniel, he told us to think about what lies behind the social determinants of health and thinking of civic engagement and power and policies. And that's critically important. And Karthik kind of laid out a conceptual mapping of what it takes to move people towards civic engagement and why it's important to do so. Does anybody want to jump in with a question? Or do we have any in our from our audience that were typed in? Going once. Otherwise, you'll have to listen to me.
Well, so while we're waiting for questions,
Okay.
Bruce, I think one thing that's important when we think about generally, I mean, in political science, I mean, I'll say as someone who has been working on civic engagement for a while, often there's an assumption that more civic engagement is always good, and a lack of civic engagement is a problem. And I think generally speaking, that makes sense. But when we think about the types of civic engagement, including protest behavior, they may be pro-democratic or anti-democratic, right? Or pro-health equity or harmful towards health equity. It brings up important questions about whether we should think of not just more civic engagement or less civic engagement, but what are the conditions under which certain types of civic engagement might improve health equity, and what are the conditions under which certain types of civic engagement may actually worsen health equity. So one quick example I'll give is when it comes to the CARES Act and even the American Rescue Plan, there are a fair number of provisions where undocumented immigrants, even though they pay taxes, have not been getting financial relief from the federal government. And that, of course, has significant health implications, especially if we talk about essential workers, including farm workers and others. So I think that's something that we need to dig deeper into. And sometimes they may be uncomfortable questions or may produce uncomfortable answers, but we really do need to dig in to think about the various ways in which civic engagement may bear a relationship to health equity.
Okay, great. Thanks, Karthik. We've got two questions that have come in. What I suggest is I read them both and then have Daniel and Karthik respond to them. Of course, the people who wrote them could say them if they prefer. But the first one is, for many of us, this material is face valid, if not in this detail. I'm hopeful you might help us find language and method to engage those for whom this body of work is literally unthinkable, as they are facing another way entirely. But they're looking in a different direction. Can you imagine working together, or is conflict the only way? That's the first one. And the second one, is there a city community that has actualized these theories to deliver impact? If so, can you name them and describe their success? Daniel, let's go to you first, since Karthik just said something. Do you want to take up either one of those questions?
I think Daniel dropped out, Bruce, for
Karthik,
if
you're
he's
on
having
there.
technical issues.
Oh, bummer. Okay, that's too bad. I'd like to hear what he had to say about this. Go ahead, Karthik.
Well, the first one I think is targeted more towards Daniel. This will come up in our measurement session right after this fireside chat. At least some aspect of not not just preaching to the choir, but seeing if there's anyone who's persuadable. When we're bringing up some of these issues. So I don't want to steal too much of the thunder. That'll come up in the next session that I'll be moderating. We'll hear from several folks in terms of what this could look like. Recently, I've heard about this frame of better arguments, right, and what that means. And I think that is something that, to the first question is, can you imagine working together, or is conflict the only way? I think that the key is not to avoid conflict, but figure out what are the ways that conflict can be most productive. I mean, that's one of the hallmark features of a representative democracy. The founders, with both their wisdom and their limitations, saw that conflict was an inherent feature of the American Republic. The question is, how do we make sure that it improves governance and in our more contemporary context, improves health equity? In terms of the second one, in terms of communities that have actualized these theories to deliver impact, can you name them and describe their success? Just for the audience, it looks like Daniel lost power and internet connection, Bruce. So it may just be between you and I for a little while, and hopefully Daniel's able to reemerge. So in terms of places that are doing this, we are starting. So one prime example throughout the country occurred with the census. So you had census complete count committees and census coalitions, thousands of them around the country, that brought together philanthropy, government agencies, as well as different parts of the nonprofit sector, including power building and advocacy organizations, service providers, and so many others. And that's one example that we have used, we as in our Center for Social Innovation have used in building out this notion of civic infrastructure. By the way, you had community serving media throughout the country, right? So not just general market or mainstream media, but also ethnic media, including Spanish language radio, Vietnamese radio, et cetera, that were part of those census coalitions. So I would lift that up as one important and promising example. Unfortunately, many of that civic infrastructure has now been folded up. So ideally, with the American Rescue Plan and other investments coming from the federal government down to localities, we have an opportunity to maintain that civic infrastructure, not treat them as periodic one-offs.
Great. Daniel, you're back by phone. I don't know if you can see the questions, but 3 have come in. And there was one I was particularly interested in having you speak to. It asked whether, as we go forward, whether we can, they said that a lot of people would agree basically with what you all said. But as we go forward, do we need to conflict with those who disagree with us, or is there a way of working together? Does that make enough sense to you?
So,
go ahead, Daniel.
Well, Bruce, yes. Can you hear me, Bruce?
Yes.
Okay, I apologize. We had a storm come right through, and my power went out and internet. So I apologize about that. I'm calling from my phone. But could you repeat the question for me one more time?
Yeah, sure. I mean, the question's asking. It said the questioner observed that what was said makes sense to them, and probably a lot of people on the call were maybe part of the choir. But there's, especially after hearing you, but there are others who would take a very different path and would be counter to this kind of theme. And do we have to conflict with them, or are there ways to join them? Is the question.
Well, I think there are ways to join. I'm one who, believes that we need to, fight the forces of division and polarization, because one of the things that I have long argued, based on what we have seen in terms of the advancement of minority health and health equity focused policies in this country, is that, it was long enjoyed, depending, of course, on the administration, bipartisan support. So it's a nonpartisan issue, and it has had bipartisan support. And I think for us, it's important to meet people where they are, right? If they may not be in tune with the language that we're using, there are other ways, I believe, in pushing the agenda and getting them to come on board. And from the model, one of the things that I've recognized, and as we've done our research, is that in order to advance health equity in this country, you usually have to align it with a commercial interest in the government investment value. And it's only in those instances, whether it's mental health reform, whether it is universal health or minority health, for that matter, those are the only times that we have seen at that federal level an attempt to get it over the finish line. So I do think there are ways to reach out to folks, but we have to meet them where they are.
Okay, great. Thank you, Daniel. Karthik, one came up for you. Did you see that one? You want me to read it, or I'll read it out and then you can take it. For Karthik from Hang Chao Yu, you have organizing under mobilization. How do you distinguish between organizing and mobilization? What are differences in outcomes depending on which approach we use?
Thanks, Bruce. I saw a couple of other questions that I'll also answer. So first, in terms of organizing versus mobilizing. So mobilization, certainly, in the political science literature, has largely been in the context of campaigns. So electoral campaigns or issue campaigns. So mobilization tends to be one-off. It tends to be targeted. It does not tend to be ongoing. Organizing is something that tends to be, it tends to last much longer. And it's not just related to, say, campaigns for federal office or state office or local office. It often blends different levels of government and policy. And organizing also often includes a social movement element in which it's not just about changing policies or getting certain people elected to office, but also changing social attitudes, norms, and preferences. So it's much more rich, much more robust than that. So a couple of other questions. One, in terms of, in terms of doing this work, in terms of promoting civic engagement infrastructure, building in a community, would there be a natural lead organization? This is something that our center is actively exploring with a bunch of other partners in philanthropy, as well as in conversations with the federal government and state government here in California. It's one thing to say that you need to build a civic engagement infrastructure. The big question is who gets the resources to build it. I'll say that this is something that'll be part of the deliberative exercise at the end of our 2-day session. So I don't want to put my thumb on the scale too much in terms of who should be the one leading it. And then finally, Bruce, I saw a fourth question that says, I'm an ethicist, and I think that behind the political determinants of health are social values, the ethical determinants of health, if you will. So the question is, are you all optimistic in America that we can find common ground on shared values? So I'll turn it over to Daniel first. I have some thoughts, but I want to toss it to Daniel to see if he has thoughts on shared values.
I think that gets to the concept that I've heard folks like pushing. It's the idea of the moral determinants of health. And I don't think we've gotten there yet, right? I think there are periods in our nation's history when we've gotten close to achieving, some shared values when it comes to equity and minority health and the like. But in terms of the shared value, I don't think we've gotten there yet to that moral determinant of health. That really is the highest pinnacle for us to reach. And I believe that through education and through our efforts to breed familiarity with other groups, we sure can achieve that.
So I'll just add one thing on shared values, and this is the work we do with our center's research and practice, as I think I've mentioned before. So there's a new project that we're launching that is statewide in California that holds on to 5 core values that spell an acronym of IRISE, and that's innovation, resilience, inclusion, sustainability, and equity. Now, others may add other shared values. We think that these are values that Republicans as well as Democrats, people of different faiths, should be able to uphold. Of course, there may be disagreements in terms of what do you mean by equity or what do you mean by sustainability. But this is where we believe that social science can help in terms of coming up with clarification of concepts as well as measures and indicators. And then people can decide what they want to prioritize, how much weight they would give to these different measures and indicators if they determine that something like sustainability is a value worth holding on to.
It looks like we're pretty much out of time. But I want to thank Daniel and Karthik for kicking it off in the way that they did. I think it was really terrific. And also I want to thank the audience for their participation. The questions were right on the things that I thought were really important for us to discuss. So,
do you have any? Yeah, do you have any thoughts yourself, Bruce? I'm curious to hear your thoughts as we close out.
I think that the way I'm looking at it, I've been around for a long time, and what I'm seeing is that this population health idea keeps getting built upon. And I think what you and Daniel just talked about is another building on it. And I find it really exciting that it's grown in that way, and really important. So that was my main take on it. And as you know, Karthik, I feel like I'm always learning from you, even though I'm the health guy. And I think I've just done the same thing with Daniel, and I got to go read his book. And that's what I find so exciting about this. And so I'm glad this is happening, and that we're having this session, and that you two set it off so nicely.